So to answer this, perhaps I'll just go through what's been happening for breast cancer surgery over the years. So in the past, the only surgery that you could have done for breast cancer was a mastectomy, which is a removal of all the breast tissue. And not only that, it was called a Holstead mastectomy, where even the muscles of the chest wall, the pectoralis, and some muscles around the shoulder were all removed as well. And all the lymph nodes were removed as well. But that was 50, 60 years ago. We have moved a long, long way from there now. Especially for early breast cancer nowadays, we just need to remove the area which is involved. It's called a lumpectomy. We just remove the cancer itself. You definitely need to go for radiotherapy after that. But in terms of surgery, it's extremely minimal now. It's just removing a small little area. Also, for a lot of patients who have got slightly larger tumors, we can now give what's known as neoadjuvant chemotherapy. In other words, giving a medication in the form of chemotherapy to shrink this lump. And if it does shrink to a smaller area, once again, you just need to do a lumpectomy.
Advanced breast cancer is often treated with chemotherapy, but that's not the only option. About half of all these patients with advanced breast cancer have a form of breast cancer that's actually sensitive to female hormones in the body. So by shutting down this stimuli from the female hormone in the body, we can actually stop the cancer from growing. We have a new generation of drug, we call it targeted therapy, or sometimes the media call it smart drug against cancer, that can overcome this cancer's resistance to hormonal treatment and extend its efficacy to 2 years and sometimes beyond, and thereby deferring chemotherapy and deferring the onset of all the side effects associated with chemotherapy. This family of drugs are called CDK4/6 inhibitor, is a new family of targeted drugs.
So nowadays, even if we do need to remove all the breast tissue, known as a mastectomy, we can actually keep the outer covering, in other words, the skin, the nipple and areola, and remove all of the inside, the cancer as well as the rest of the breast tissue, and then fill that cavity inside with either an implant or the patient's own tissue, what's known as reconstruction. There are actually a whole myriad of surgical options besides just the traditional type of mastectomy. And hence, it's always good to speak to your surgeon properly before you undergo any of these surgical options.
Surgery plays a very important role in the management of breast cancer if we discover it early enough. In other words, if the cancer is confined to the breast or just breast and the lymph nodes under the armpit. But if unfortunately the cancer at the point of discovery is advanced, it has traveled to multiple parts of the body, we adopt what we call a whole body, a systemic approach using anti-cancer drugs so as to bring the cancer under control simultaneously. Early stage breast cancer can achieve a long-term permanent cure rate of 80% or 90%. Patients actually have the odds on their side if they act on it quickly. But sitting on it is a potential disaster because the window for cure is not forever open. And once closed, once the cancer is spread, you can't reopen that window again.
Absolutely.